Hi, my name is Robert Hershey, and I'm a first-year student at Concordia University, Irvine. This is a classroom presentation for Class 602 with Dr. Kristi Cronan for Acceptance and Commitment Therapy. The background history of ACT is that it's a behavioral-based theory. It's a one that emphasizes awareness and mindfulness. As a contrast to a lot of cognitive behavioral therapy in which dysfunctional thoughts are challenged and addressed, ACT allows the client to not to seek to change their thoughts, but merely it looks to explore their relationship with these distressing thoughts. Goals of ACT, they have some overlap similarities with existential and Gestalt theories, essentially just to help provide meaning and purpose for the client. And just in the general goals of the client has a lot of self-awareness of what's going on with them. And the therapist is there to help encourage them to bring a lot of their values and their distressors to light. ACT is also just kind of seen as like what's called a third wave of progressive behavioral therapy, kind of started near the end of the early 2000s. It's alongside other therapies such as DBT, MBSR, and NBCT. Behavioral therapists are most widely used treatment interventions. Key concepts and tenets. ACT it's an empirically based psychological intervention, and it uses mindfulness, behavioral change strategies, and acceptance to increase a client's psychological flexibility. You're going to hear psychological flexibility getting mentioned a lot with ACT, and we're going to define it in many different ways throughout this presentation. But essentially, it just kind of it means the ability that a client will be able to have, and the ability that we are able to have when we experience a distressing moment or an emotional thought or a feeling. And a lot of times with, again, like with in direct contrast to CBT, where we see a distressing thought or a problem, we say, well, we must address that, we must challenge it, we must change it and remove it. ACT does a different approach with its mindfulness and acceptance baseline, and that it's more passionate about what is our relationship to the distressing thought, what is our relationship to this emotional imbalance that we might be feeling, and is there a way that maybe acceptance commitment therapy can help achieve the same goals, but in accepting our situations. So in another summary, ACT prioritizes acceptance and present situations and letting go of current obstacles. So again, it's kind of like a non-antagonistic approach to our distressing thoughts, and it's a way of trying to accept our realities that we experience. Theorist C.S. Hayes, he writes, and I quote, that acceptance is not merely tolerance. Already I was thinking about unquote, I was already thinking about tolerance as like a word for acceptance. But as he continues, quote, it says, rather it is the active, non-judgmental embracing of experience in the here and now. So again, acceptance is viewing ourselves in our distressing thoughts, not in a judgmental way, not in a way of where we need to challenge or change or uproot, but rather it's like, is there a way that this is a part of who I am? It's not who I am. It's not who I want to be, but it's here with me. And I must find a way to grow and to experience through it. So again, that comes through growing in our psychological flexibility. That is the goal of ACT, and uses the following skills in treatment. Acceptance, and I'll define acceptance here in a later slide. Living in the present moment, it's a very present-minded approach to therapy. Diffusion, this is also like observing self as context, determining values, and taking committed actions. All of these things combined kind of like formulates what we mean by increasing our psychological flexibility. The therapist is basically collaborative, mostly with the client. A therapist will prioritize a non-judgmental, a warm presence, and it's inviting processing through the therapeutic relationship. Therapy involves assisting clients who choose values that they want to live by and executing specific goals. So again, a therapist is using what the client is leaning with what their shared values are, with how they even source like their emotional imbalance or like their dysfunction that they're experiencing, or the pain or the problem. Again, the therapist is going alongside their values, they're going alongside their what they're choosing to live by and prioritize and what their goals are. And therapist just seeks to encourage those out. Client is encouraged to have commitments for action in pursuing a meaningful life. So this is the second part of the therapeutic relationship, is that the therapist is there to help create these goals, to help create these purposes with the client, so that it is a collaborative, but the therapist is here to help kind of show the way, or show a way of how a client can create action, create commitment and growth in their relationship. Goal of a therapist is to model the non-judgmental awareness of cognitions for the client. So therapist is here to, again, through their non-judgmental presence, through their even like their own acceptance of themselves and of their world and their surroundings, it is a model for the client to be able to feel and experience as well. This works really well in ACT group counseling scenarios where there's acceptance and commitment that happening through a group, through peers. So this is really strong as well. The therapeutic process and goals, again, psychological flexibility. It is the being able to sit in our moments of hardship. And it's not erasing ourselves from it, but it's to view ourselves in the midst of it without being controlled by it. As some therapists have described, it's like being wowed by the moment instead of being controlled by it. I think they call it a sunset, the sunset wow. So it's just like we see our problems, we see these moments, and instead of being pulled by them and being moved with them and kind of like this push back and full and kind of like being controlled, it's more of just being able to, okay, can we see what's going on and actually step back? Can we step back and look at what this is? And can we create a sense of wow? Can we create a sense of, oh, this is a lot right here. And it's a part of who I am. And it doesn't have to be who I am, but it's a part of me. Acceptance, very core tenet of the process and goals. It is our openness and awareness with social mindfulness. Wanted to add in the social mindfulness just to show that ACT has a strong foundation as far as our awareness isn't just about us having a selfish awareness of what our needs are and what we want to do, and kind of like creating like an isolation of ourselves, but to show that this is actually a very social thing. Like this is something where we're at a place of work, or out shopping, or a place in public, and maybe something happens, something's triggering, but our acceptance is founded on seeing ourselves as among others, and we see others among ourselves. And so it's like this openness, this awareness. Again, this is foundational for a therapeutic relationship. A therapist will seek to establish this as a core foundation for the client, for the client to be able to then take and apply it with committed action, but to have acceptance also, like just kind of throughout their personal life. Commitment is the skills in processing and moving forward. We cannot move forward with commitment without the foundation of acceptance. If you move forward with commitment, you are ignoring a very core tenet of acceptance, which is the non-judgmental, the accepting, like the understanding awareness that we have of our problems. And if you move too quickly with commitment, you can override the acceptance, and then therefore you aren't even accepting the bad things, but rather you're moving more into maybe cognitive behavioral, where you're trying to then control against these feelings rather than trying to live with them, just in harmony, I guess is the right word to say. A technique that has been shared as common is called a two-paper technique. And so where a client may write down on one side piece of paper, it can write down what are your goals, what are your values, what are strengths that you have, what are things you want to go towards, and all of those good things. And then you can flip the paper on the other side, and then you can just say, Now write all the bad things that are going on. What are all the negative things? What are the things that are obstacles? What are boundaries that you keep rubbing against? Like what is the sort, like, what are things that you can say that's preventing you from the growth on the other side of the paper? And what a client will be able to be developed through this practice of awareness and acceptance is that often there are things that you write on one side of the paper that will have direct correlation with things on the other side. And if you want to remove any of the negatives, you in fact may be removing a positive inadvertently. And so again, ACT is about increasing psychological flexibility to be able to sit with these good and bad things, but then to be able to create this a growth mindset, not through wanting to change our distressing thoughts, or rather feeling led and controlled by them, but accepting them and to know that we are not defined by them. Specific application. There's research that was done with ACT for specifically for cancer survivors. This research was done in Australia with a program called Places You'll Go. And this research has collected some data that adolescent cancer survivors as a foundation, they can suffer from general anxiety, post-traumatic stress, other cancer-related anxieties. These anxieties could be survivor's guilt, where a person maybe feeling guilty because maybe they've successfully gone through cancer treatment, but then maybe some of their peers or other people that they know did not. And then there are remissive feelings of guilt that can resurface for cancer survivors. Another cancer-related anxiety is cancer reoccurrence, and this is a fear that that any illness that maybe you be getting, or maybe like just a simple headache or stomach cramp or something like that, and you think that cancer has come back, right? And that can generate anxiety for someone. So ACT is similar to behavioral change techniques. It shares a lot of the same type of dialogue and relationship that the therapist has with the client. But again, with ACT, it focuses on the individual's relationship with the distressing thoughts and feelings. So for example, this is the survivor's relationship with cancer. So how is this person, if we're looking at adolescent cancer survivors, how is this cancer survivor view their relationship with cancer? Like what are the actual distresses? What are the things that get brought out? And what is their relationship with this? And ACT seeks us to explore that relationship, and through that relationship, again, increasing psychological flexibility. And we see it through acceptance-based coping, diffusion and mindfulness, commitment to values, consistent behavior. So with a foundation of ACT, the Places You'll Go program, this was organized. It provided 5 group therapy sessions to help increase the psychological flexibility. And these are all group counseling sessions, and it ranges from experiences where maybe a person is just sharing their story and what type of cancer and what those treatments are, and just kind of like a basic introduction of themselves. Their treatment history, their survivorship journey, all of those things. And then it slowly branches into, okay, now share about maybe some of the general anxieties you might be experiencing. Tell us more of your story. What is your story? What are things that are blocking you? And like, what are things that recur in you? And so when you create those safe environments in these therapy sessions, and specifically the ACT, in a group environment with peers, it has tremendous positive reinforcement that can happen, lots of strengthening that can happen, and where through this program specifically, it received very, very high reviews and critiques, and the success of the program. Additional neuroscience research. Again, as we've just been saying it, like acceptance and living in the present moment, these things, the skills that ACT has, it's gained a lot of popularity to address a lot of psychosocial stressors. It's been empirically shown to be very effective in treatment of a variety of disorders, including not limited to substance abuse, depression, anxiety, phobias, post-traumatic stress disorder, and other chronic pain. This is my presentation on ACT, and I hope you've enjoyed this video. And that you got a really brief introduction to the world of acceptance and commitment therapy. Thank you.